दिखा तेज दिखा।
Okay. So Vaishnavi, how much time you will take for the answer? Did you? Oh, I got the answer from your side. So you both are working on the second question now. Gauri, any anticipation time? That how much time you will take?
Ma'am, we can solve the question.
Okay. Basically, is from Kashish. Chalo, let's do it together. So the first question is, surgeon is removing the gallbladder and happens to notice the appendix looks abnormal. Therefore, the surgeon decided to go ahead and remove the appendix also. So in our case, doctor removed the appendix as well as the gallbladder. Both has been performed. Now we are able to rule out the option number A because this is just for the appendectomy and we cannot use primary code as an add-on code. Let me pull this code here. It is 44955. So this is an add-on code. How we have identified this is add-on code because we have this icon at the beginning of the code. So whenever we have this icon at the beginning of the code, that means we cannot use this code as a primary procedure. So first option has been ruled out. Now we are left with option B, C, and option D. The difference between A, B, C, and D. In the D option, we have the code from the laparoscopy approach. We cannot use this code because appendix has not been removed with the laparoscopic approach. It has been excised. So this is an excision instead of the laparoscopic approach. So we have to rule out option number D also. Now we are left with option number B and option number C. The difference between these two, the code 44950 and 44955. If we read the description of 44955, it will tell us that we have to use this code when the appendectomy is done for the indicated purpose. Indicated purpose means the doctor needs to do the appendectomy because there is some issues or the concerns or the indications or the diseases due to the appendix, and this needs to be done with any other major procedure. But in our case, we does not have any indication before the procedure for the appendectomy. So whenever there is no indications before the procedure or during the preoperative time, and doctor need to do the incidental appendectomy with the other procedure or during the intra-abdominal surgery, in that case we have to build 44950 itself with the 52 modifier. So remember one thing, while doing the questions, it is very necessary to read the parenthetical instructions we have at the bottom of the codes. So we have to read the parenthetical instructions which we have at the bottom of the codes before selecting the correct code. So the correct answer for this question should be B instead of the C. Clear to everyone?
Yes, ma'am.
Perfect. I'm moving further to the next. Gauri, clear to you also? Or did you have any questions here?
Yes, ma'am. I'm clear.
Okay, moving further. In this case, patient having a right upper quadrant pain, nausea, and there is a suspicion of having a stroke or any other obstructions in the bowel tract. And now patient is coming for the ARCP under the radiological guidance. Doctor prepare the patient, place the anesthesia, and then scope has been inserted through the oropharynx, esophagus, and diaphragm. And after the complete observation, it was described that patient have the stone. Then stone has been removed, and after that, rest of the biliary tract was visualized. So whenever a complete biliary tract or a complete pancreatic duct has been reviewed, or tract has been reviewed, in that case we will consider ERCP complete. We will use code ERCP with 52 modifier if only one portion of the pancreas or one portion of the biliary duct has been reviewed, then we will consider this as an incomplete. So in our case, complete biliary tract has been visualized. So we are going to consider this ERCP as complete ERCP. Whenever you are going to bill for the endoscopy procedure, you have to remember with the endoscopy procedure, we have to append the 52 and 53 modifier if it is not completed based on the instruction mentioned in the manual. And how we will identify that how much portion we need, we have to refer the statement in the manual. So I'm going to pull the code for the ERCP. So our ERCP code starts from here. And it is mentioned that we have to consider ERCP complete if one or more ductal system has been reviewed, and one or more ductal systems are either pancreatic ductal system or either biliary tree. So in our case, biliary tree has been reviewed, so we are going to consider ERCP is complete. Now let's move back to the question. We have these options 0, 6, 5, 4, and 9. So 43260 is endoscopic diagnostics. Diagnostic means when the patient is coming for the diagnosis of a condition and the condition is not identified already, doctor need to identify the condition. So that is diagnostic. Next options we have for the surgical endoscopy. Surgical endoscopy means that doctor is doing any procedure in conjunction with the ARCP. Let's say if the doctor is taking any biopsy, doing the papillotomy, he's performing any procedure in conjunction with the ERCP, then we are going to call it as therapeutic. So if the doctor is doing therapeutic as well as diagnostic at the same time, we have to build the surgical only, therapeutic only. We are not going to build the diagnostic. Diagnostic ERCP is always included into the surgical endoscopy for the same site. If both the procedure is performing on the same site, we have to build the surgical only. We are not going to build for the diagnostic. So in our case, 43260 is a diagnostic. So we have to rule this out. Next option is 6564 and 69. 64 is removal of calculi. Calculi means stone. So here doctor is removing the stone. So it should be option C only. Sorry, option C only because doctor is removing the stone. Let me read the description of 265 also. So 26265 is a destruction of calculi. Destruction means doctor is crushing the calculi. So that is not the case in our situation. So we have to rule this out too. And 269 is 269. Okay, so 2 to 6, 9 we does not have the option, so answer should be C. Any questions here? Any doubts, any question?
No, ma'am.
Now let's move to the other chapter. So today we are going to start the pathology section. Okay. So the first section of the pathology and laboratory. In the pathology and laboratory section, we have a course for the performing the test. If there is any specimen and doctor is doing any test on that specimen, in that case, we are going to pick a code from series 8. So any procedure performed by the pathologist, we are going to code that procedure with the series 8. So the first section is organ or disease oriented panels. Organ and disease oriented panels means if you go for the body checkup, so if you have to check for the thyroid, so there is a thyroid panel in which doctor need to review or the pathologist need to review the few parameters that covers into the thyroid panel. So we have a few codes for the panels. Panels means a particular panel includes a basic test or this test needs to be included in that panel, then we are going to build that panel. So the general health, like you can see here, general health panel includes the comprehensive metabolic panel, CBC, thyroid stimulating hormones. So if you're going for a particular test and doctor mentioned any particular text, so each component you are not going to build separately. You have to build the panel specific. You don't need to build each component of the panel. If the complete panel has been performed, you have to build the complete panel. Each component is included in that panel. So let's say there is a case and doctor advised to go for the basic metabolic panel. You are going to build 80047 for the basic metabolic panel if patient's calcium ionized, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, and one. Everything is reviewed, then what you are going to do? You are going to build 80047. If let's say there is a case where the calcium ionized is not being measured. So if the calcium ionized is not measured, that means you need, then in that case you have to build each component separately. In that case, you are not going to build panel because the complete components is were not reviewed. We have to build panel only if all the components has been reviewed. If all components were not reviewed, so in that case we are not going to build the panel. We have to build the each component separately. Also, with the panels, we cannot use modifier 52. So we cannot use modifier 52. So whenever there is a panel and you are going to code for a panel, you have to make sure that all component has been measured. If all components were not measured, in that case you have to build individual components. You are not going to build the complete panel. The first guideline. Second instruction we have, we cannot build same component twice. Same component twice. That means, let's say if the doctor ordered basic metabolic panel and comprehensive metabolic panel. So if we see basic metabolic panel and the comprehensive metabolic panel, same type of component except the calcium ionized. So except calcium ionized, everything is covered into the comprehensive metabolic panel. So we have a carbon dioxide, chloride, creatinine, potassium, sodium, and then we have the BUN. So everything apart the calcium ionized is already covered with the comprehensive metabolic panel. So what we will do in this case, we will bill for the highest panel, and addition to this panel code, we will bill calcium ionized separately. Why? Because the calcium ionized is not included in the comprehensive metabolic panel. So whenever we are going to bill for the panel, we have to follow the two rules. The first rule is we have to code for the highest panel, and we are not allowed to use the 52 modifier. Panel needs to be built only if all the components were reviewed. If the complete components were not reviewed, in that case, we are not going to build the panel. We have to build components separately. And if any component is not included in the panel, in that case, we have to code that particular component separately in conjunction with the panel. Any questions till now?
Yeah, ma'am, I didn't got the last point.
Okay. Let's say doctor ordered basic metabolic panel with calcium total and calcium ionized, both. Okay. So in that case, if we are going to build 80048, calcium ionized is not included in the 80048. In that case, what we will do? We will build 80048 and we will code calcium ionized separately with 82330. So we will build 82330 as well as 80048 because all components of the basic metabolic panel has been reviewed. So we are going to code this, as well as there is additional component which has been coded, which has been measured, which is calcium ionized. So we are going to build calcium ionized separately. Okay, Kashish?
Yes, ma'am. Thank you.
Okay. Now I'm going to send one question. We will do that question together, then we will Okay, I've shared one question. Go through with that question and tell me the best option. And you have to make sure that you guys are not allowed to use modifier 52 as well as modifier 22 in conjunction with the pathology section. So the 52 and 22 modifier is not allowed with this section. Any other answers? Okay, now let's do this together. Let me copy and paste the question. Okay, so in our case, doctor ordered two panels, basic metabolic panel as well as comprehensive metabolic panel. So as we discussed, we should not bill same component twice, and if we bill 80053, all of these components are included into the 80053. But we have a specific different component here, that is calcium ionized, which is not included in the 80053. So as this is calcium ionized, which is not included in the 80053, so in that case we have to build calcium ionized separately in conjunction with the 80053. So we have to build 80053 and 82332. Answer should be B instead of the options we have given A and D. Jamil, we cannot build D because calcium ionized is missing in the option D, and we cannot build A because we cannot build same component twice. These components are included in the 80053 and we have to build a same component only once. So the answer should be B. Clear?
I have a doubt.
Tell me.
Sorry, I'm a bit confused. Means in question it's asked that basic metabolic. So
Mhm.
it will not come 80047. 80047 will not come 80047. 80047 will 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 come 80047. 8
it also says, uh, okay, 80047 is basic metabolic panel. In your
Yes.
question, patient is coming for two panel. Okay, provider ordered two panel, basic metabolic panel with the code is given 80047, and the comprehensive metabolic panel, your code is 800453. And the question they're asking, what should you report? You should report both the codes, you should report this, or you should report this, or only this. So we have both the panels on the same date of service. So 0053 and 47. Does that answer your question? It's not the one basic metabolic panel. It's both the panels has been reviewed.
Okay, ma'am.
Still question, you can ask if you have any question.
Yeah, means if the answer is B, 80053, then how will we report basic metabolic rate?
Basic metabolic components. Carbon dioxide, chloride, creatinine, glucose, potassium, sodium is already covered here. So we will,
Yeah, got it. Sorry, ma'am.
it's okay.
Thank you.
Let me see if I can find any other question for the panel. So it does not have any question here. It's A2. Let me see. A2. Can you try to solve the question number 53? Let me mention the WhatsApp chat also. Try to solve this now. I'm doing another question because we anticipate there is a one question we can CPC exam in the CPC exam. So we can anticipate there will be a one question in the CPC examination from this panel itself. Now let's do this question together. So in our case, doctor ordered an electrolyte panel. Order from supplied by this company indicate following test included: carbon dioxide, chloride, glucose, potassium, and sodium. So 1, 2, 3, 4, 5 tests. Company perform all these tests. How should the lab company report these services? First, we will try to find the code if there is any particular panel code we have. 80051. In the 80051, we have 1, 2, 3, and 4 component: carbon dioxide, chloride, potassium, and sodium. Carbon dioxide, chloride, potassium, and sodium. So glucose is not covered in the electrolyte panel. So in option number B, we cannot build 80051 with these components separately. So our option number B has been rolled out. As well as if the 4 test from the one panel has been done, we have to code the panel. So we have to rule out the option number A also. Now we are left with option number C and D. So the answer should be D because we have to build glucose separately. So 82947 is for the glucose and we have to build that separately. Gauri, we cannot build components separately if we have a particular panel code for that. So if the 4 components, if we have the panel for these 4 components, we have to code the panel only. Okay?
Yes, ma'am. Understood.
Take a moment, read this paragraph quickly, and then we will move further. Reading done. Any doubts, any questions in the panel?
No, ma'am.
Okay. So after panel, our next topic is therapeutic drug acids. So we have 2 type of drug acids in the therapeutic drug acids, presumptive and the definitive drug class. In the presumptive drug acid, doctor is just checking the presence of the drug in the patient's blood or any specimen. So to see if there is a presence of drug or not, like possible use or non-use of that drug, they will use a code from the presumptive drug class. And to see what is the quantitative and the qualitative, what is the level of that particular drug, particular one drug, not just absence and presence, what is the level of that drug, we are going to build that with the definitive drug class. So in the presumptive drug class, we have 3 codes. I'm going to pull that code here. These 3 codes, 80305, 306, and 307, comes under the presumptive drug class. We have to build this code only once, irrespective of the number of drugs. We have to build this code only once per date of service, and this code is based on the instrument. So if no instrument has been used, it should be 80305. That means if the direct optical observation has been done, there is no instrument, then we are going to use 80305. If the instrument is used, we have to use 80306. And in conjunction with the instrument, if the chemistry analyzer, so any random analyzer has been used, in that case, we have to use 80307. So So the difference between 80305, 306 and 307 is just an instrument. These codes will represent whether the drug is present or absent in the patient body. It will not tell a particular drug. So to identify a definitive drug, we have to use a code from this series. This is a definitive drug class listing. In the definitive drug class listing, we have a particular drug class mentioned here. So if the doctor is doing the test for a particular drug class, we have to use a code from definitive drug session. And just to see if the doctor is just using drug class or doing the essays, just to see if the drug is present or the absent, in that case, we are going to use a code from series 80305, 6 and 7. So we just have the two series 305, 6 and 7 as well as the therapeutic drug assays. We can build both the codes together if doctor did presumptive drug class first and then he did the definitive drug class. So if he did both the things, then we have to use both code together. But if the doctor did just a presumptive drug class and not the therapeutic drug class, then we have to build only one code. Clear? Clear
Yes,
to
ma'am.
everyone? Okay. I have sent the question. Refer the question number 18. Try to solve the question number 18. Just try to solve the question number 18 is 350. Try to solve it by 352. Sorry, I incorrectly mentioned 18. It should be the question number 21. Okay. Now let's discuss this together. So in our case, patient has a history of depression. Patient came to the ER. Doctor ordered the drug screening for this and this drug. So it's a definitive drug. So first, we did the drug class using a immunoassay with the random access analyzer. So it's a chemistry analyzer. So presence of each benzodiazepines. So definitive drug is done for the benzodiazepines only. And drug confirmation is performed to identify a particular drug. So to test if the random access analyzer has been used, that means chemistry analyzer has been used. So we have to use 80307 and remove the rest options. So option A, option D has been ruled out. We are left with option C and option D. The difference between A and D, 346 and 345. We are not going to use 345 because benzodiazepines has been reviewed. So the correct answer should be C only. Kashish, clear? The Y answer should be C instead of the D.
Ma'am, I have a doubt.
Yes, go ahead.
Immunoassay is written, so it is included in 80306. So I changed the answer.
Immunoassay in a random access analyzer. So it is based on the instrument itself. So if the chemistry analyzer, which is a random access analyzer, RIA, is used, so we have to use 80307. Okay. If only the immunoassay has been used, then we can use 80306, or any instrument has been used, then we can use. But if the random access analyzer has been used, any chemistry analyzer has been used, then we have to use 80307. Okay.
Yes, ma'am. And ma'am, I have one more doubt.
Mm-hmm.
Actually, when I read it again, 80305 and 80306, the only difference is in immunoassay.
No,
Can you
the
please
difference
read
is
in the
that
difference here?
yes, the 80305 is read by the direct optical observation. We are not using any instrument in the 80305. And in 80306, instrument is used. So 80305 without instrument, 80306 with instrument. Okay?
Okay, ma'am. Thank you.
Okay. So moving further, you have to remember you have to use this code only once based on the analyzer or instrument. You cannot, irrespective of the number of the drug class. So if there is a multiple drug class has been done, still you are going to use only one. You are not going to use this code twice on a same data service. So after the definitive drug class or therapeutic drug assays, we have a next section, evacuative suppression testing. So I'm going to pull that. Eight zero four zero zero. Here we go. So the next section is evocative and suppression testing. This describes how well various endocrine glands are functioning, and we have a different code and the subsection of the several tested, which is performed after the evacuation or evocative and suppressive agent has been inserted or administered into the patient body. So in this case, we are going to see the performance of the glands, that how the glands are working. So the first code is 80040. This is ACTH stimulation panel. You are going to build this panel if the 2-time cortisol has been reviewed. So if only cortisol has been reviewed twice, then you are not going to use 82533. What we are going to do? You have to code 80400. We have to code the panel only. We are not going to fill the component twice if we have the panel. And the insertion or the administration of the agent, we have to code that separately with the insertion. Next code is 80402. This is also for ACTS simulation panel. In this, we are using cortisol as well as hydroprogesterone. If with the cortisol, hydroprogesterone is reviewed, we are going to use 80402. And if the with the cortisol, hydro 17 hydroprogesterone is used. Okay, can any one of you tell me the difference between 80406 and 80402? What is the difference between these two? 80402 and 80406.
Ma'am, other one that is 17 hydroxyprogesterone is different than 17 hydroxypregnenolone. Hello.
Oh, sorry, I'm talking about the right. So very good. In this section, we have a progesterone, and this section we have a pregnenolone. So whenever you are going to code from this section, you have to make sure that you are going to read the panel components very carefully to make sure there should be no confusion. And if there is a panel code available, we have to use the panel code itself. Okay. I have one question for you guys. Let's say patient is coming for the growth hormone suppression panel, and doctor checked the glucose 4 times and HGH 4 times. How we are going to do? Doctor came for the GHS panel, and for GHS panel, doctor did glucose testing 4 times and HGH testing 4 times. How we are going to build?
Ma'am, in this
We'll
code,
use both the codes, ma'am.
it's mentioned here. Human growth hormone HGH 83003 into 4 times. They have mentioned it here.
That means we have to use 83004 and 82947 into 4. This is what you want to say? Or do we have to follow any other approach here?
We have to follow any other approach, ma'am.
Okay. So in this case, what we are going to do, we have to code 80430 because this panel is completely performed. You have to remember one thing. Whenever there is a code, there is a panel code and the complete panel has been performed, you have to build the panel only. You are not going to build the component separately. And the additional glucose, because in the panel only 3 glucose is covered. So for the additional glucose test, you have to use 82947 separately. So we are going to build 80430 and 82947. Clear? Any questions here?
Okay.
No, ma'am.
Okay, perfect. So this is the same guideline which we have for the panel. So I'm moving further. After the panels, we have this pathology clinical consultation section. In the pathology clinical consultation section, we have a code which we need to use if our pathologist is providing the consultation. So let's say there is an MD. MD wants our pathologist, we are doing the billing for the pathologist. MD wants our pathologist to provide the consultation. So if it is requested by the MD or the provider, then only we are going to bill the pathology clinical consultation codes. So these consultation codes is always billed based on the MD request. So if the physician asks our doctor to provide the consultation, then only we have to bill. These consultation codes are based on the time as well as MDM. So let me pull these codes here. So these codes based on time and MDM. MDM means medical decision making. MDM means medical decision making, which will represent the severity and the complexity of the condition. So we will represent the complexity and the severity of the condition with the help of MDM. We have a particular process to calculate the MDM, which we are not going to discuss it today. So these are the MDM table. I'm not going to discuss this MDM table right now. We will discuss MDM table when we are going to discuss the ENM. So same MDM table we have to follow here. In the MDM we have three sections: low, moderate and high. So if it is an low level of MDM, we have to use 80503. If it is in moderate, if it is in moderate, 80504. If it is in high level of MDM, 80505. This code is also based on time. So if 15 minutes is given, it should be 80503. If the time given till 40 minutes, it should be 504. If the time given till the 60 minutes, it should be 80505. And for more than 50 minutes, we can use the prolonged services. We have to use 80506 for each additional 15 minutes. Here we have a description as 30 minutes, but we can build this code whenever 15 minutes is completed, and we can increase the unit after the okay. Next section we have urinalysis. So for urinalysis, our code is 81000 to 81099. These tests include simple and complex tests, and all these tests are performed on the urine sample because it's a urine analysis. So these tests are performed on the urine only. So we are going to build 8100, which describe a simple test, simple urine test, dipstick test, where we have to check the changes, common changes in the urine, which will indicate a particular disease. So it's a very basic dipstick test, a simple test. It's a non-automated test. And then we have 81001. This is automated with microscopy, and this one non-automated without microscopy. Then we have 81005, urinalysis, qualitative or semi-quantitative, except immunoassay. So code 81005 to 81020. This will represent the complex analysis, which will measure the quantities of these changes or the screening of other conditions. So these are comes under 81005 to 81002 comes under the complex test. What they will do? It will represent the changes and screening of any other conditions if doctor wants to. Next, we have this 81025 urine pregnancy test by the color comparison. This is a similar to the test which is commercially available over the counter like Prega News. So these tests are commercially available in the as an OTC. So next we have 81050, which is volume measurement for the timed collection. And the time we have to follow here, 24 hours. So in this test, doctor is checking the amount of urine produced over the period of 24 hours. So in the volume measurement, we are checking that how much urine has been produced in 24 hours. That is also called as an 24-hour urine. So 24-hour urine test. Next, we have molecular pathology. Molecular pathology examine the nucleic acid. So DNA and RNA. So that will represent the nucleic acid to determine if there is any changes in the genes or any changes in the germline or any inherited conditions, hereditary conditions, any somatic conditions such as neoplasm or these type of conditions we were going to check with the molecular pathology. So these tests are based on the gene to gene variant. So let me pull this code for your reference. Gene to gene. Okay. Okay. Let's check for this code 81220. So we have to build this code based on the how the test has been performed. All the molecular pathology codes are based on the how the test has been performed. So for CFTR, here CFTR means cystic fibrosis transmembrane conduction. So it's a gene analysis where CFTR is a name of gene. CFTR is a name of gene. And the condition from this gene is cystic fibrosis. This is an example of the condition. And what we are doing here, we are doing gene analysis here. And then we have the common variant. Common variant or the different variants like familial variants are based on the ACMG or ACOG. ACMG means American College of Medical Genetics and Genomics, and ACOG means American Congress of the OB and Gynecology. So these ACMG and ACOG will represent the type of genetics and genomics variant. So based on the ACOG, if we are checking common variant, we are going to use 81220. If we are going to check the familial variant, we are going to use the 81221. So this code is based on the how the test has been performed, not the analyte, as well as what is the variant which we are going to analyze. Any questions here? Okay. Next thing we have to make sure to follow in the molecular pathology. So whenever there is a procedure such as microdissection, which is performed prior to the cell lysis, which we need to do for the molecular pathology, we have to build the microdissection separately. Need to build microdissection separately. So we have to build a microdissection with the code 88380. We have two codes for the microdissection. which needs to be performed or billed if the microdissection has been performed before the cell lysis. Next section, next thing we have to focus here, we have to append the modifier 26. Why we need the 26 modifier here? If the doctor just interpreted the test and not performing the lab procedure, he's just interpreting the molecular test or molecular pathology, then we have to build this code with the modifier 26. Now let's move further. I'm moving to the chemistry section now, 82009. Still the genetic testing only. This section, chemistry section. Our codes begin from 82009 to 84999. So in this section, we have to, if the doctor need to detect any particular condition, any particular substance, which is, it also includes the natural occurring substance or any toxic effects which is due to the therapeutic drugs or non-therapeutic drugs or any other substances. So in that case, we have to pick a code from the chemistry section. So all these tests are listed in the alphabetic order. So these tests are listed in the, let me show you here. So you can see here, first we have a code from A series, then we have a code from the B series. So all these tests are listed in the alphabetic order. Also, in this section, diagnostic codes are included. So if we are going to build this code from this section, molecular diagnostic tests such as nucleic acid or genetic tests are included. Then you do need to build the molecular testing at the same time. Next section we have question here. We have to focus on these four codes. These four, 82270, 71, 72, and 74. We had this question in the previous APC exam, in a CPC exam. The difference between 82270, 71, 72, and 74 is based on the screen. So if the doctor is checking the patient's blood occult for a colorectal neoplasm screening, then we have to use 82270. Here, the sources are feces. 82270 needs to be used if the sources are feces. If sources other than feces, for a colorectal screening, we have to use 82271. And if the doctor is checking blood occult for other than colorectal screening, doctor is not going to check for the colorectal cancer. In that case, we are going to build 82272 if the sources are feces, and 82274 if it is by the fecal hemoglobin determination by the immunoassay, and this is without immunoassay. So these codes, the blood occult codes, are based on the whether it is a neoplasm screening or non-neoplasm screening. So if it is a colorectal cancer screening, you have to pick a code from 70 or 71. If it is other than colorectal screening, in that case, you have to use 72 and 74 only. Any question in these four codes? Okay.
No, ma'am.
Okay, let's move further then. I think I have a one question. Just give me a second. Huh? Can you try to solve the question number 8? Just try to solve this question number 8, please. I have pulled these codes here. Just refer the question from the WhatsApp and try to solve this question ASAP. I just realized that I was speaking in the mute. Okay, so now I have a question. Why you guys use the 82270 for a colorectal screening? How you have identified that the patient is coming for the colorectal screening? That 70 is for colorectal screening, right? How you have identified?
Ma'am, it was mentioned in the question the patient was provided with a single triple card. That's why I chose option number C.
But that is not only the factor to choosing the 82270. Your answer is correct. Everyone's answer is correct. We have to use 82270 itself because patient is coming to get a screening here. So here we have a documentation. A patient is coming for a screening. Whenever we have a word screening, that will represent the colorectal neoplasm screening. Okay, clear? So answer is correct. I just wanted to know the concept. Okay, let's move further. After this, our next main topic is surgical pathology. These all are the chemistry only. Okay, we can refer the hematology and coagulation section also. We have to refer the code from the hematology and coagulation section. When the blood counts are used to evaluate and diagnose the diseases or any other related abnormalities related to the blood or bone marrow, then we have to use a code from series 85002 to 85810. So any condition related to the blood counts, blood or bone marrow, we have to use a code from series 85002 to 85999. So our first code is 85002, bleeding time. This code will represent the coagulation factor. What is the coagulation factor in the patient body? With that we will be representing with the 85002. Next we have a complete blood count. Complete blood count includes a hemogram and the differential WBC. Hemogram means the enumeration of the red blood cells or the white blood cells or the platelets, as well as if there is a determination of hemoglobin, hematocrit, and the indices. So CBC is blood count, which always include the differential WBC. So in the hematology and the coagulation section, we have the two type of codes, blood test and the bleeding time test. In the bleeding time, we are checking that when the blood is coagulation. What is the coagulation time? Next important section. These are the basic tests. So I'm not going with the each test separately. I'm skipping it out. Okay, here we go. Surgical pathology. Surgical pathology code needs to be used whenever we are doing pathology on the surgical specimen. Let's say there is a surgery, and after surgery, we got the specimen and we are doing the pathology on that. In those cases, we have to use a code from 8330 to 8309. This code is based on the type of the specimen, as well as the condition. So, whenever you have to code this, you have to first see type of the specimen. Type of the specimen, and the next thing you have to review how the specimen was obtained. First point, type of specimen, and second point, how specimen was obtained. So let me show you the example. So you can see here in option 88304 or in code 88304, we have the abortion. As well as in the 88305, we have the abortion, the specimen received from the abortion. The difference between 88304 and 5 is spontaneous and the induced. In the 88304, specimen received in through the induced abortion, and 88305 through the spontaneous or missed abortion. So whenever you are going to quote from this section, you have to refer two things. First, you have to see the specimen, the type of specimen, and after reviewing the type of specimen, you have to see how the specimen has been received. So these two factors will help you to determine the correct code. Any doubts here? Any doubts, any questions?
No, ma'am.
Okay.
Ma'am,
I'm going.
what does it
Sorry, I missed your
in
question. Can you
abortion
repeat?
section?
Mm-hmm.
Yes, in abortion section it says spontaneous or missed. So what does
Mm-hmm.
it mean?
Spontaneous and missed abortion is miscarriage. That means patient is not coming for the induced abortion, but due to the miscarriage, doctor need to do the abortion. Or due to the spontaneous miscarriage or spontaneous demise of the baby or the fetus, doctor need to do the abortion. So that is spontaneous and missed. And the induced abortion means electively patient chose to terminate the pregnancy. Clear?
Okay, ma'am. So if there is a series of miscarriages, so that is different thing, no?
If it is a series of miscarriages, like the patient had the previous miscarriage, we cannot do the pathology of the previous miscarriage now. The surgical pathology section needs to be used whenever you receive a specimen after the surgery. So for the previous miscarriage, we cannot use the specimen now, right? We does not have the specimen either. So this is not based on the previous or now. This is just based on the specimen which you will receive after the surgery.
Okay, ma'am.
Okay. We will do one example. Try to solve the question number 26. Try to solve this out. Two things you need to focus on. First, type of specimen, and the second thing, how the specimen was obtained. Any answers? Okay. Shall we do it together? Or
Yes,
you
ma'am.
need one more? Okay. So, like in this case, patient is coming for a pathological examination. Ischemia in the left leg. Patient have this ischemia in the left leg. Specimen is 1.5 centimeter of a single portion of arterial plaque taken from the left common femoral artery. And the second specimen is 8.5 2.7 centimeter across the. So this is basically a size of the specimen. Patient have the cutaneous ulceration, that means skin ulceration, with the fibropurulent material on the left leg. And now question is, what should be the surgical pathology codes we have to use? So two specimen has been taken, one from the common femoral artery and the second specimen is from the cutaneous ulceration, that is skin ulceration. So let's see where the artery and the skin is. So here we have the artery that includes erythematous plaque also. So patient have the same condition. Patient have the plaque. Next option we have okay. As we are going to bill for the pathologist, that means we should not use a modifier 26. So our option B and option C has been ruled out. We are left with option A and option D only. Okay. So back to the question. Patient came for the pathological examination for the common femoral artery and the second specimen is the skin. So we will rule out one by one. So we have to use 88304 because in our option, patient is having the artery issues. So the code should be 88304. So we have to rule out the option number option number D, because in the option number D, we does not have the arteries. In 88307, let me pull that up. So in 88307, we does not have the artery, as well as we does not have the skin. So skin and artery both are missing. So we have to rule out the option number D. Next option is 88302. In 302, we does not have the artery, but let's see if we have a skin. We do have a skin, but that is for the plastic repair. In our case, it's not the plastic repair. In our case, patient have the cutaneous ulceration. Patient have the ulceration in that skin. So we have to rule out option number A also. Now let's see the difference between B and C. So for artery, we have option 304. Arteries is missing. Sorry, in the 88305, we do have artery, but this is biopsy, so we are not going to use this code. Let me see if we have a skin here. Yes, we do have a skin here, which is other than cyst tag debridement because it's an ulceration. So it is other than cyst tag debridement. So we can use 88305 as well as 88304. We cannot use 307 because in 88307 neither we have the artery nor skin. So answer should be B. So the correct answer should be B. Any doubt here? Any doubt, any questions?
Ma'am, before
No,
you
ma'am.
ruled out for the 26 modifier.
Yes, because I thought it should be based on the physician only. So now we have the documentation that we have to bill for the pathologist. So in our case, pathologist is not taking the specimen, is just interpreting it, right?
Yes.
That's the only reason we have to use this code.
Okay, got it.
Any other questions? So you just have to make sure that this code is based on the type of specimen as well as the condition or the how the specimen has been taken. Do you want to do one more question here or should we proceed further?
One more, ma'am.
Okay. Try to solve the question number 13. Okay, Jamil, you used option number A. In the documentation, it was mentioned we have to report technical and professional component both. So if we have to code both, that means there is no need to add any modifier. Professional means 26, technical means TC. So whenever you have to build a global code, it should be without modifier. Clear? So the answer
Okay,
should be
ma'am.
D only.
Okay, ma'am.
Perfect. Now let's move further. So if in conjunction with a surgical pathology doctor is doing the spatial staining or any decalcification or the frozen section, we have to build that separately. So I'm going to pull the code for the frozen section here. This is the 88329232. These codes are for the frozen section and this code is based on the tissue block per specimen. So if two specimen were taken, we have to use 2 units of 88331 because this is per specimen. So for each specimen, we have to use this code. And for each additional tissue block per specimen, we have to use 88332. Clear? This code, the frozen section code, is based on the tissue block as well as the specimen. If more than one specimen has been taken, you have to use 88331 per specimen, and after the first specimen or after the first tissue block per specimen, you have to use additional code for each additional tissue block. Any questions here?
No, ma'am.
Okay. Now let's see if we have anything important after this. These are the codes for the micro dissection, which we need to build with the DNA and the microscopic codes if micro dissection has been performed before the cell lysis. This section is for the reproductive medicine procedures. So any procedure related to the eggs as well as sperms, we have to use this code here. That's it. So this chapter has been completed now. I have already shared the questions for the 4 series as well as 8 series. Try to complete these questions before the end of the next week. And in the next session, first we will discuss the 4 series and then we will discuss the 8 series questions. Any doubt here? Any questions here?
No, ma'am.
No, ma'am.
Okay. If no questions, then we can wrap up the session. Thanks everyone. Thanks for your time.
Thank you, ma'am.